Autism Spectrum Disorder Interventions by Brandy Richter, Department of Psychology, Liberty University. During this presentation, I will discuss 3 interventions that may be used to address the deficits associated with autism spectrum disorder. What is autism spectrum disorder? The Diagnostic and Statistical Manual, or DSM-5, categorizes autism spectrum disorder as a neurodevelopmental disorder. One with autism experiences deficits in social communication and social interactions, which are evident across various contexts such as social reciprocity, nonverbal communication, developmental skills, and maintaining and understanding relationships. One with autism also experiences restrictive, repetitive patterns of behavior or interests and activities. As individuals develop and mature, their symptoms can evolve and may be masked by coping mechanisms. What is applied behavior analysis? Applied behavior analysis, or ABA, has its origins with the publication of Skinner's book, The Behavior of an Organism. Skinner identified 2 types of behavior: respondent or reflexive behavior, and operant behavior, which is influenced by past experiences. Behavioral interventions seek to identify the underlying mechanisms and environmental influences that lead to the development and persistence of certain behaviors. The BACB, or the Behavioral Analysis Certification Board, a board that oversees professionals in the field of applied behavior analysis, created a hierarchy of professionals to develop programs and implement ABA-based intervention methodologies. This hierarchy includes board-certified behavior analysts, or BCBAs, registered behavior technicians, or RBTs, and behavior technicians, or BTs. Methods utilized in ABA-based interventions. There are several methods used in ABA-based interventions. These methods include discrete trial training, or DTT, the Picture Exchange Communication System, or PECS, augmentative or alternative communication devices, or AAC devices, and social skills training. Researchers believe that DTT is a highly effective teaching method that breaks down a concept into smaller increments using drilling activities that use shaping, prompting, prompt fading, and tangible reinforcement. Researchers Ali and Fazil found that DTT yields improvements in several skills, which include self-help, academic, expressive and receptive language, communication, social, and motor skills. PECS is an exchange system that uses pictures for communication and is taught through a 6-phase process. An AAC device, or a tablet, is a high technology device that uses a program which speaks out loud to communicate. Zohorian et al. Found that PECs were successful at teaching English to children with autism. The researchers found a significant improvement during their intervention phase when compared to their baseline phase of treatment. Aftab et al. Found that using an AAC device for a child who cannot communicate verbally, specifically a high technology device such as a tablet, showed a noteworthy increase in speech production, social communication, and social interactions. ABA-based intervention methods continued. The Premack principle, also known as Grandma's rule, is the principle that applies a contingency in which a child must perform an action or task to gain access to a reinforcer. An example of this would be when a child wants to have access to a game. Their parent puts a contingency in place in which they have to clean their room or perform an action to gain access to that game. Herod et al. Conducted a retrospective study that showed that there was a significant positive correlation between using the PREMAC principle and response rate. There are many ways that ABA-based interventions target social skills deficits, and the PEERS program is one of these methods. The PEERS program was developed to target the social deficits associated with autism. It is delivered across multiple sessions and concentrates on communication, turn-taking, and play initiation. Tripathi et al. Found that PEERS significantly improved targeted social skills, and these skills were also shown to be maintained in follow-up sessions. Now we will discuss play therapy. Play therapy. Early interactions with peers can set the pattern for all future interactions. Child's play helps in the development of many skills such as social communication and addresses behavioral challenges. Play therapy provides strategies to implement beneficial participation, skill acquisition, reciprocal play, help with learning to understand symbolism and abstraction, and increase social engagement. Social skills were found to be the most commonly targeted skill for play therapy. Research also found that play therapy targets language development and early communication skills. Play therapy can be utilized by parents, teachers, psychologists, and speech therapists, and also be used across several settings. Researchers Shire et al. Found that the program's JASPER and JASPEER play interventions improved social communication, joint attention, and behavioral regulation skills. Children in this study showed significant improvements in pre-symbolic and symbolic play, which research has shown is a critical skill for cognitive development. A second study that examined sand play therapy conducted by Yuxi et al. Found that using sand play therapy positively impacts social communication. Our last intervention for the deficits associated with autism is cognitive behavior therapy. Cognitive behavioral therapy, or CBT, is a widely used intervention that employs several approaches to address the maladaptive behaviors associated with autism. CBT is a method that incorporates psychoeducation to help individuals learn coping strategies. It involves training in cognitive and behavioral skills to assist in recognizing and altering unhelpful thought patterns and behaviors, as well as fostering the development of new, healthier behaviors. Additionally, it includes exposure therapy paired with response prevention. CBT is often considered a first-line treatment for some pediatric disorders, such as obsessive compulsive disorder and anxiety disorders. Researchers Voss et al. Use a modified version of cognitive behavior therapy known as functional-based cognitive behavior therapy, which applies visual aids, extended cognitive components, and social skills training while incorporating a participant's interests, self-monitoring, and increased parental involvement. The study showed that the therapy significantly decreased compulsive behaviors. Yu et al. Also found that CBT significantly improves social skills and anxiety in children with autism. Conclusion. Many interventions can be used to address the deficits associated with autism. Three interventions that can be implemented include applied behavior analysis, or ABA, play therapy, and cognitive behavioral therapy, or CBT. ABA uses methods such as discrete trial training, the PREMAC principle, social skills training, and communication training, which utilizes PECs or an AAC device. ABA has its origins with B.F. Skinner's research and is an effective and evidence-based treatment that researchers have shown to increase communication, address maladaptive behaviors, and improve social skills in children with autism. Play therapy is a treatment that also addresses the social deficits associated with autism. Play therapy can be used by many practitioners and across several settings. Researchers found improvement in pre-symbolic and symbolic play, increased social engagement, joint attention, communication skills, and behavioral regulation skills after an intervention that utilized play therapy. Cognitive behavioral therapy, or CBT, is a widely used therapy that employs several methods to help one learn coping skills, change maladaptive thought patterns and behaviors, and increase communication skills. References. Thank you for watching my presentation.